Fantastic. Okay, my next guest is Daniel Warner, CEO and co-founder of MediSeen Health. Daniel, why don't you come and join me? Great to have you here.
Thanks for having me.
How are you doing this afternoon?
Everything's great. It's been fast and furious today at StartUp Health Festival, day number 2. So
things are going fast?
Really enjoying it. Really fantastic meeting so many disruptors in the health and wellness space and so many like-minded VCs and strategics that are really helping all of us hit our moonshots.
Fantastic. Okay, you're with MediSeen Health. So tell me what you're building. What's it all about?
So what it's all about is that we believe that healthcare should happen anywhere. Right now, the healthcare system is constrained by clinics and clinic hours. Why is that? So we try to envision a system where whether you're a boomer, whether you're a millennial, healthcare can be accessed anywhere at any time, leveraging things like mobile healthcare and virtual care.
Okay. So walk me through it. Let's say I'm a patient. I'm on MediSeen. Am I given it by my provider? Do I download it on the App Store?
Absolutely. So MediSeen right now is available both on web and app. We are a practice management tool, a clinicless practice management tool, which enables any type of non-acute healthcare practitioner, whether it is a family doctor, a social worker, a dietitian, a personal trainer, what have you, to be able to offer care outside of a traditional clinic or even gym setting. We enable them through our software to be able to build their own schedule, offering either virtual or in-home or in-office care around their community. If they're offering virtual care, then they set it around their province or their state. If they're offering mobile health care, they can literally draw their borders. It's almost like thinking of the community as a clinic.
Okay. Break that down for me a little bit more. I'm not sure I understand. What do you mean thinking of the community as a clinic?
So we believe that the future of healthcare is clinicless. It is wherever the patient is. So whether you're a really busy millennial who needs better access to care but you just don't have the time, or you're an aging boomer who needs that access and you struggle to frankly get to a clinic, we think the future of healthcare is in your home. So whether you're
or wherever you
are. So whether it is virtual in the palm of your hand, or quite literally at your doorstep, our software enables our client, who is a health and wellness practitioner, to be able to launch their own website, to be able to build their own brand, to be able to be booked directly. Analogy that we like to use is we want to become the Shopify of healthcare, right? Shopify enables brands to sell directly to their customers and leave the retail store behind. So what we want to enable within MediSeen is enable the health and wellness practitioners to leave the brick-and-mortar clinic behind, which is typically only open, let's say, being generous, 9 to 5. But there's 168 hours in a week. Why can't healthcare be offered more regularly to be able to reduce strain off of clinics and hospitals? And so whether you want to be able to seek out mental health care or physical therapy, food, nutrition, or even primary care, why can't that care come to you? So our practice management tool enables healthcare providers to be able to launch their own webpage or be discoverable through our free patient app, be able to create their own schedule, do all their charting, do all their payments and reimbursements through our platform.
If I'm a provider, let's say take this down the road a couple years, and this becomes ubiquitous. How is this improving my revenue? How is this improving the business side of my practice?
I'm really happy you asked. So typically when you graduate or if you're an associate, you don't own your own clinic. So right now, approximately 90% of the health and wellness space, they're associates. They're clinicians who don't own their own practice. So what does their lives look like? They're typically, scotch taping their work week together, working at anywhere from 1 to 4 clinics. In a lot of ways, if I were them, I'd feel like Uber. So what we're aiming to do is encourage them to effectively embrace the gig economy in the right way and be able to offer either virtual or mobile healthcare. And so when you have that alternative of offering that differentiation and saying, hey, I can come see you in your home, or I can come pop by in your office, or if it's after hours and you're putting the kids to sleep, I can just hop on a virtual call. And so when you start thinking more holistically about healthcare, you start to wonder, why have we built the capacity around the clinics and around 9 to 5 when healthcare can happen anywhere and people are generally very busy. So by offering that more holistic approach, it enables better access to care, more proactive healthcare. And we certainly work with healthcare and wellness providers that are a little bit entrepreneurial, like to tell their story, are a little bit more digitally inclined, and we're just trying to help them enable their independent practice goals. And so our software enables them to be more discoverable or be seen, hence the name MediSeen, of course. And be able to offer that better access to care that their community sorely needs.
I see. So the being seen piece is that you're opening them up to new clients.
Absolutely.
In the community.
We're helping them think about healthcare, about their practice in new and exciting ways that really is very current with the way that healthcare is moving. It's moving more into the community and more being more patient-centered. And so we are trying to enable them to lead the charge and be able to create a global healthcare movement, similar in a lot of ways to what StartUp Health is doing with all of us through the support and the encouragement and the connectivity. We're trying to do the exact same thing by helping them embrace their inner entrepreneur and provide, frankly, the care that they were trained to do. They were trained to be business people or lawyers or accountants. So with our back-end software and our coaching programs and with our corporate perks programs, like we have some really exciting partnerships with BMO, which is a bank, Lyft, Microsoft, Hub Insurance, and so many others. Like we want to give them the tools to be able to be successful as independent care practitioners, to either augment or replace what they're currently doing in a clinic where they, again, they're told when to work and they typically give up 40-50% of their billings. So might as well, generate more income for themselves, achieve more work-life balance, the freedom and flexibility that they really want to pursue, and deliver that patient impact that both patients young and old really do need.
It's awesome. Daniel, thanks for coming into the studio. We're going to keep watching what you're working on with MediSeen.
Thank you.
And excited for 2020 for you, okay?
Thanks for having me.
All right,
really
Daniel.
Appreciate it.
Have a
great
good
one.